Welcome. This is Chapter 17, the Thyroid Gland. The material for this lecture comes from sections 3, 4, and 5 of Chapter 17. And the reason that is because I tried to pull together all of the information that pertained to the thyroid gland. That includes synthesis and how it works. Alright, so let's take a look. The thyroid gland is the largest endocrine gland. We have two lobes and an isthmus. It's H-shaped, okay? And it envelops the trachea anteriorly. So, this is important because if you look where it's sitting, if this thing, if you have a thyroid tumor, let's say, one of the potential things that could happen is it could push on the trachea, which is no bueno. You'll also notice that it's highly vascularized. Well, it's an endocrine organ, and if you remember, hormones are dumped directly into the bloodstream, so they need to have the tissue needs to have a good blood supply. If we look at the microanatomy, which is really the next slide, the thyroid is divided up into follicles, sacs that compose most of the thyroid, and they're going to contain this protein-rich thing called colloid. The follicular cells are simple cuboidal epithelium. Let's have a look at this. It's on the next page. Oops, no. This is the from APR. This is what the thyroid looks like. It's going to show you all the lobes and pieces. Here. All right. So these are the thyroid follicles filled with colloid, and you can see the simple cuboidal epithelium. Remember your cuboidal epithelium, the cells are roughly equidimensional, and the nucleus appears to be nice and round in the middle. The cells that compose the follicles are the follicular cells. However, you'll notice that there's another group of cells labeled here. These are the parafollicular cells. I don't remember if you remember the C cells. They play an important part in regulating calcium. So those are the C cells. They produce calcitonin. But follicular cells are going to produce this colloid of thyroglobulin. Thyroglobulin is a large polypeptide, all of tyrosine residues. And what it does is and they have iodine added to them. So inside of there you have lots and lots and lots of this protein, and then when we need thyroid hormone, basically the hormone is just, they chop up the colloid into pieces and that gives you your hormone. We'll look at that later. There are thyroid hormone is composed of two hormones. Thyroxine called T4 and T3 triiodothyronine. So let's have a look here. Notice the difference between T4 and T3 is the number of iodine. T4 has 4 iodine, right? And T3 has 3 iodine. Okay. This type of hormone is what we call a monoamine, meaning that it's derived from a single amino acid, and in this case it's tyrosine. Okay, so this is our, sorry I didn't have anything else I wanted to talk about there. Nope, that's it. Okay, so this class of hormones are that should be monoamine, meaning they're made from derived from one amino acid, that's tyrosine, and then and then iodine is added. Okay. And we're going to talk a little bit about the synthesis of these hormones. in a moment. Control of synthesis and release of thyroid hormone is under the control of the hypothalamo-pituitary thyroid axis. Okay, so in response to cold, acute psychosis, circadian rhythm, a couple different things, it's going to stimulate the hypothalamus to release TRH, thyrotropin releasing hormone. That in turn will stimulate the anterior pituitary. The anterior pituitary will release thyroid stimulating hormone, and the TSH will go and it'll stimulate the thyroid gland. And it'll cause the gland to grow and to synthesize hormone. Okay? Once thyroid hormone is produced, the T3 and T4 will go to the peripheral tissues and exert their effect, but they'll also feed back to the anterior pituitary and to the hypothalamus. Notice we have a nice, let's change color for this actually. This is where red is actually appropriate. Notice we have a nice little negative sign here. That's the feedback of T3 and T4 to the hypothalamus and the anterior pituitary. This gland is the thermostat of the body. It's going to regulate the rate and intensity of chemical reactions. Okay? So let's look at some of the effects that we have. First and foremost, it raises oxygen consumption, and in doing so, raises O2. And in doing so, it also, it's going to raise the metabolic rate, O2 consumption, and we're going to get heat production. Heat production, we call this the calorogenic effect. So that's the heat production. In addition, because it's ramped up your metabolism, essentially, it's going to increase your appetite, okay? And make you, it's also going to increase your respiratory cardiovascular systems, right? Because you have a higher oxygen demand, you need to get oxygen to those tissues. In addition, it's going to accelerate breakdown of carbohydrate, fats, and proteins for fuel, which makes sense. And then we have some other effects. It does promote alertness and quicker reflexes. It amps you up, basically. It's going to promote growth hormone secretion, promote growth of bones, skin, hair, nails, teeth. So you can see how this hormone with growth hormone will be important in coordinating development. And, promotes development of the fetal nervous system. So, the other hormone produced by the thyroid gland is calcitonin. We talked about it. So this is what the effects of T3 and T4. Let's talk about this monoamine and how we make this thing. Okay. So, what happens is iodine from the blood is absorbed and oxidized. Okay. And then the follicle cells, they synthesize this protein called thyroglobulin. Thyroglobulin is a polypeptide of tyrosine residues. It's all the same. Okay? And when the thyroglobulin gets secreted into the follicle, the center of the follicle, as it enters, iodine is added. And the different tyrosine residues are going to interact and bond. And then, when you need T3 and T4, the follicle cells take up this colloid, and a lysosome is added to the vesicle, and it chops up the thyroglobulin. And what you get are pieces that have 3 iodine and pieces that have 4 iodine. Okay? Right. So, let's talk about iodine, T4. So, this hormone behaves very, very, very similarly to the steroid hormone. And it behaves very similarly to a hydrophobic hormone. Okay? So what happens is T3 and T4 are bound to proteins in the blood. They travel through the protein bound. Only a small amount is left unbound. Okay? And when they get to their target, the T3 and the T4 are released from the protein. And they are able to diffuse across the cell membrane. And when they do that, and when thyroid hormone is produced, it's primarily producing T4. Okay? T4 is the less biologically active form, but 80 to 90% of the thyroid hormone that's made, let's write this down, 80 to 90% of circulating thyroid hormone is T4. However, that's the less biologically active. So what happens is T3 and T4, when they diffuse into a cell, the T4 actually gets broken down to T3, I should say metabolized, to T3, and then it's actually T3 that has the effect. Okay, and what T3 does is it increases the transcription and translation of certain proteins within the cell. And one of those, by the way, is the sodium-potassium pump. So this is how, and we'll see this when we talk about classes of hormones and hormone actions on Tuesday, how this looks very similar to what happens with steroids. So that's how thyroid hormone exerts its effect. Let's talk about what happens when thyroid gets going wrong. We end up with a condition known as hyperthyroidism. And I wanted to show you the kitty cat too. But here's what you're going to see. I trained as a veterinarian, and there are a lot of hyperthyroid kitties. So this is a really common presentation. What you get is this cat coming in. It's usually ill-kempt. It's underweight. And cats usually are very fastidious groomers. So when a cat comes in and it's not grooming itself, something's wrong. So this cat, you can see, looks unkempt. It's underweight. And if we were to listen to its heart rate is through the roof. And it's fidgety. It's like jittery, okay? These same symptoms you see in people, but we have some other interesting ones. The other one that you see, and in that cat, you're also going to see vomiting and diarrhea because it's overstimulation of the digestive tract. But in people, you see a couple extra things, or one in particular, and that is exophthalmos. Okay? And that's bulging eyes. So you will see bulging eyes with this condition. Plus, of course, the telltale sign of a goiter, right? A big lump on the neck. Those are the two big giveaways. Nervousness, sweating, high body temp, all of those things. Because your body is ramped up. One of the causes of this, of course, you could have like a thyroid carcinoma or something. The other option is that there's a disease called Graves' disease, which is an autoimmune disease, and actually the antibodies mimic the effects of TSH. So your thyroid gland thinks that the hypothalamus and the anterior pituitary are saying, make thyroid hormone. Whereas what it really is it's antibodies binding to the receptors and triggering that response from the thyroid gland. And the way that we can tell, the one you would diagnose Graves' disease by looking at the TSH levels. Because if you remember, I'm going to draw a quick version of this. Hypo, TRH, ant pit, TSH, thyroid, right? And then your thyroid is secreting T3 and T4, which should provide negative feedback. So if the anterior pituitary, if this is the case where it's Graves' disease, and these antibodies are mimicking TSH, then your TSH level should be very, very low. So that's how you would distinguish this disease. Interestingly, goiter can be a clinical sign of both hyper and hypothyroidism. On a previous slide, we'll have to flip back a few. Let's go back to the regulation slide. If I flip back just these 2 slides, 3, okay, maybe 4, here it is. You'll notice down here that low iodide stimulates the thyroid gland, right? So, this is a case of dietary insufficiency of iodine, okay, and it presents as a goiter as well. Finally, we have hypothyroidism, and hypothyroidism can be the result of 2 different things, okay? If it's present during development, and this is fetal development, what you get is you get something called cretinism, and that's the picture over here. And the child is a dwarf, mentally retarded, and has physical deformities, and you notice there's an interesting shape to the face here. Okay. So that's what happens when you have hypothyroidism during development. Excuse me. In another group that we tend to see it in is in our geriatric patients, and hypothyroidism is called mixed edema. This is in your notes, and you'll see we have a slow heart rate, low blood pressure, lethargy, sensitivity, cold. If you think about what the thyroid hormone does, it ramps up your metabolism, causing you to produce more heat, and it makes you more alert. When you don't have that, it's going to have these other effects. Muscle weakness, hair loss, obesity, because you're turning down the metabolism. One interesting side effect of it is something called myxedema madness. Myxedema madness actually is a psychosis that develops due to hyperthyroidism. It's pretty impressive. Anyway, that is my presentation on the thyroid gland, synthesis of thyroid hormone, transport of thyroid hormone, and thyroid dysfunction. Thank you for joining me. See you in class.